Well, welcome. Tonight we have an old veteran of the show who's come all the way as he's now back at Harvard Medical School or Mass General Hospital. I can never tell which is which, but he really stimulated some thought, and a lot of people sent in notes when we talked about adolescent PTSD. Tonight we're going to talk about sensory stimulation effects. Again, when I read the latest chapter, I was absolutely enthralled and amazed. But let's start with an introduction.
Sure. Dr. Levine, I previously was here for close to 5 years as the director of Tri-County Medical Associates Behavioral Health Group, and I think I left in 2015, so it's been about 2 years, actually.
And we appreciate you coming all the way from man's greatest hospital here.
Well, it's actually almost as good a commute coming over from the other side of Milford here than it is from Boston.
I was going to say, it has become interesting because I'm coming from Woburn now.
Oh, is that right? Yeah, that's quite
Take me an hour and a half, hour 40, and then all of a sudden I got 35 minutes to cross Milford, and it's like,
yeah.
Okay, where did that come from?
Well, it's a very busy place here. This is the center of the universe, right?
There you go, you remembered.
Yes.
Now, sensory stimulation affecting wound healing. I was fascinated.
Yeah, this was a very interesting finding. We actually developed this somewhat serendipitously. We were looking at the effects of isolation rearing on rats, and because we were interested in how can we develop a model system. We can look at emotional development and actually psychotropic medications for children who are exposed to deprivation and neglect and difficult childhood environments, but in a model system with rats. And the surprising thing was, if the rats were brought up in a single cage with one rat, they had very different behavior. They had extreme hyperactivity. They were not social or overly social, just like many of the kids who grow up in orphanages and have neglect. They're either very inhibited or they're overly socially with strangers. And so we saw these behavioral effects, but then we noticed that they would pick at themselves and develop wounds on their skin. And it turned out that the wounds that they occasionally picked in the isolation single chamber rat were never healing. And the rats that we put in a cage with two rats, simply giving them another rat, healed within a week. So we had a 4-week difference between rats that were just not having a peer and rats that did. So and the behavior with these rats was, when the two were together, they played all day long. They tousled, they turned, they bit at each other. They'd cause a couple of wounds, but it was fun. They looked like they were having fun, and a little hard to tell with rats. But the interesting thing was, if you put them in a new cage with the singly housed rats with even with. Usually we put them in two isolation reared rats in a single cage, neutral cage. They would socialize, and they'd be playing they were like craving stimulation. They would, if we put them in a open field test where we'd see if they would run around, the amount of running they would do was like 10 times the amount of running of a rat that was brought up just with another rat. So we would separate these rats at day 17, which is equivalent to, say, 4 years old in a human. So by day 25, these rats were, almost entering puberty. So it's sort of like in 7 days you got to puberty.
Right.
So it's an easy model to look at, and at that point, already, you put them in a cage with another rat, not having 7 days of deprivation, and they were overly social. You put the rats that were brought up with another rat in a neutral cage with another rat that's foreign to them, and they
stay
separate.
away.
They stay away. So then sort of we got into, so these are some of the behavioral things, and we tried to use medication to see if we could reduce some of the behaviors, and we got trends, but it wasn't great. But one of the most interesting things was these marks on their body, these physical impairments, and so.
And that's amazing to me, because when I think of sensory stimulation, and you said it affects wound healing.
Yeah.
No, my mother always yelled if I had the music up too loud, sensory stimulation would wound me.
Yes.
But, when you think of an open wound, it just...
Yeah, these were, and then we actually were, because we were working at Shriners Burns Hospital for Children, we had a lot of kids who were coming not from the greatest backgrounds, who tended to, be a little predisposed to getting burns as very young children. Those kids who we were sort of modeling with this animal model, so we then gave them a small wound onto the backs of the rat. The animals that were brought up with another rat, their open wound, this was like a 40% wound on the back of the rat, 40% closure, complete closure within a week, and within the animals that didn't just simply, the only difference was not having a pier. They just remained wide open.
Now,
so how is that? That you stimulate, they toss, they turn.
and this is what I'm trying to understand. I mean, a wound.
Yeah.
Okay, so you get a wound, call down, say, hey, neutrophils, need
Yeah.
your help, get up here.
Exactly.
Neutrophils, call the macrophages.
That's right. That's the
You
healing.
know.
So right. There's the three phases of wound healing, which are the inflammatory phase. Then after the inflammatory phase, you have the scar formation phase, and then you have granulation tissue, and then you have this scar formation, basically. And the granulation tissue just never formed. So the neutrophils weren't getting to the right place. So the neutrophils are those cells that, come in and clean up, initially fight off the infection, or fight
But
off
you got an inflammatory response.
Yeah.
But that's it.
You got an inflammatory response, but it was not it was like an excessive inflammatory response, or in some cases it was an under-inflammatory response. We didn't study as much at the skin level to know exactly what the difference in neutrophil counts were, but clearly it was a very different inflammatory response, because when we took slices of the skin, we could see very significant difference in the keratin, which is the top layer of the skin.
So now, you start by looking at a deprived environment and an enriched environment.
Mm-hmm.
Somebody like you, DEEE,
Yeah.
everybody else says LMNOP. What does that mean?
So deprived environment is a situation that you say, well, it's below the norm for what does that organism need. So for a rat, rats are pretty social. If you had mice, they might not be needing as much contact, but the rats, pups, they like to play with each other. So you take that away, you're taking away a normal amount of environmental stimulation. On the other hand, you can do too much stimulation, right?
Well, I was going to say, but doesn't that go over the edge if you put too many pups together and they become too crowded?
Yeah, there's an optimal amount. If you put just giving a lot of rats into a single cage doesn't necessarily make the rat feel better or the animal feel better. So we're getting on rats a lot, but I wanted to mention this has been done with humans. So studies have been done with patients where you're having marital stress, and you do a simple, like, tiny little blister wound on the on a patient.
Yeah, the divorce study.
Right. These are so there's an emotional deprivation, marriage breaks up, and you just and these were well-controlled studies, and a lot of ethical issues about giving a wound to somebody who's going through a divorce, but there's an understanding that we were studying something important about how do you heal, how does the body heal, under psychological stress, and is it important? Is it relevant? And these were the initial studies that sort of that showed that. So anyways, these wounds just like in the rats,
Didn't heal.
they didn't close nearly at the rate.
Right.
And a very interesting finding is that we gave these psychiatric medications and we didn't see much effect. But then we gave oxytocin. Oxytocin is a hormone that's released by when the mother delivers a baby. The mother gets a surge of oxytocin. The oxytocin is what drives the contractions for labor, but also goes to the brain. It actually is some people call it the love hormone, the trust hormone, the bonding hormone. Fathers get it too, actually, hit out oxytocin. It's released from the hypothalamus. So it's released from the hypothalamus, it goes down to the uterus, causes the contractions, but also goes up to the brain. And it hits a center in the brain that's associated with bonding. We gave oxytocin to the rats who were deprived, and their wounds healed, almost at the rate that the wounds healed in animals who were brought up with other animals. So, we didn't get any effect from Zoloft. We got a lot of effect from oxytocin. Recently, there's been some literature on the effect of oxytocin in autistic children. So there's nasal oxytocin. And a number of trials have looked at what's the effect of giving a hit of oxytocin to a child who's sort of staring, an autistic child, not related.
Not focusing.
And there seems to be like a very brief, because its half-life is something like 30.
You metabolize it so quickly.
Break it right down. But during those 30 minutes, there was an increase in eye contact, increase in connection. So again, we were seeing that something that biologically triggers a kind of feeling of connection, even without the other rat, had an effect on the wound. The third thing we did was say, well, maybe there's other kinds of stimulation that you can provide, sensory stimulation. So what about if we looked at the cage and said, let's put some stuff in the cage? So a lot of people, this isn't like our own unique model. There's a lot of studies on DEE. DEE is deprived environments, EE is enriched environment. So, the optimal environment, you don't really need to do a whole lot for. People heal naturally. If you don't have to go out and enrich the average or the person who's got a reasonable amount of enrichment in their life. You shouldn't super enrich somebody, So the interesting thing was if we gave these plain cages a certain amount of enrichment when they were deprived of a partner rat, their wounds also healed, almost as well. Nothing was quite as good and quick. By about week 2 or week 3, we had good closure. I mean, the isolation-reared rats never closed.
Never closed.
Never closed. So it was a delay, oxytocin, and just giving them a ladder, giving them a particular type of bedding. We used this thing called Carefresh. It was like a little cotton.
Right. Well, the different appearance of the bedding showed almost a comfort level.
Yeah, it was like inanimate stimulation. So there's a question like, well, what kind of stimulation could you provide to offset someone who is deprived? Do you have to give them presumably in a person you would have to give them a human supplement, or maybe, I think it would be somewhat inhumane to talk about, giving them, a better bedroom without.
Right.
But the idea is that different kinds of sensory input in at least an animal model show similar kinds of effects to the optimal effect, which is having a partner of the same species.
Now, when I go through high anxiety, and obviously a divorce is pretty high up there on the trauma, but what can you do as a physician if you know that? If you know I'm going through a divorce,
right,
and I have an accident or something, how does that affect the treatment?
So there's a sort of the standard, therapy kind of approach to helping someone, which is useful. But obviously, if you're now more isolated as a result of the divorce, the implication from this kind of research is that, one, for your physical healing and your physical well-being, you'd want to encourage the person to get the kind of sensory stimulation that whatever decrease is aberrant for them, is abnormal for them, you want to bring it back to baseline. I mean, they may, let's say the person's a quiet person and their main source of stimulation, or sensory input was their spouse. So now they don't have that sensory input. They're home alone all day. There's kind of a deprived level of input.
Kicks in.
The deprived environment. And they're going to have more wounds, less. I mean, this is not to say that all physical illness is a result of anything like this, but it predisposes.
The day that you have a diagnosis for all humans.
Yeah.
I think aspirin is the only pharmaceutical I've ever seen prescribed on a per human basis.
Right.
You know, you're over 55, you're an old man, take 80 milligrams.
Right.
But I'm twice the weight, who cares? Take 80 milligrams. That's the only thing I've ever seen. So
88.
nothing is.
It's an 88, I think it is, right, or something.
Is that what it is? I thought baby was 8.
Yeah.
But when you look at somebody who's gone through a divorce, lost their spouse,
Right.
and you can sit there and say, well, wait a minute, if your normal environment is really stimulated by your partner, doesn't mean go out and get married or go to Daters or Us or whatever.
Right.
But
yeah. Bring back something that's
go
stimulating.
join some kind of club or
yeah,
something.
sort of analogous to the animal studies, you know, and then maybe it isn't for the moment the spouse. Maybe it's, you know, playing music. Maybe it's going to a sports event, or maybe it's, you know, just getting
to
something,
local high school
whatever
games.
stimulates you and gives you pleasure. I mean, essentially, we're getting at probably also the pleasure center, because this is what, if you look at the animals, they're getting an awful lot of pleasure out of playing. It's
Yeah,
very
it's playing,
they're
nipping.
playing all the time, constantly, all day
And
long.
I could see that somebody who's very introverted, and maybe the only time they went out to the symphony, to whatever, was with their spouse.
Right.
I mean,
Right. And
I
then,
mean, it was funny because
which is probably why, you know, someone who is a little more extroverted, more social, may do better after kind of a separation in terms of
even though the level
coping,
goes down, it's not.
or they know how to compensate. They sort
Well,
of
you know,
feel,
it's funny, you don't think about it, but a memory comes up when we were living in Paris. My darling bride went home for a week and a half because I was going to Novosibirsk in November, and she said, I'm not going there, it's too cold. So she calls me up on a Saturday morning, it was 2 a.m. I didn't even think, I'm in my office, and the phone rings. And I said, how did you know I would be at the office? You know, okay, if somebody told me when I was young that I'd be alone, a bachelor in Paris,
yeah,
and I would choose to go sit in my office and work,
right.
and her reaction was just so, well, where else would you be? And I thought about it because normally if we
yeah.
were home,
Yeah.
the two of us would go to a restaurant,
Yeah.
we'd go out, and here it is, she's gone. And for that one,
And you know, one of the things that has always been a constant in the epidemiological research on health is, you know, women live longer than men, and generally speaking, women are more social, and men, you know, sort of get into this. You're talking about, you didn't see yourself as a younger person as antisocial in any way or introverted, but you know, you get into this lifestyle where most of your social exchanges are through your work, and that's your social life, and you sort of, the way not to say women who work aren't that way, but you know, women even in the workplace, studies have shown, are more social. They tend to be the ones that are more likely to create a party.
you may have introverted women who
Sure.
lose their spouse,
Oh, yeah.
and
Yeah.
now they retreat.
Yes.
Like I said, I didn't even think about it. It just, I got home. I'd flown in Friday night from Moscow. I got to the apartment. Saturday, I didn't know what to do. So Saturday night, I took
Yeah.
the train into Paris
Yeah.
and went to my office and just started working.
Right.
And it was just so funny at 2 a.m. when she said, well, where else would you be?
And you'd probably be good with that for a while. but
Yeah,
you
but
go
one
but you-
weekend.
You know, one goes on for a week, and then 2 weeks, and all of a sudden, and then there's the idea of there's another interesting finding that, you know, very successful men after divorce do particularly bad. The fall in terms of the emotional toll on them is greater than it's unrecognized. You know how important that spouse is to the
I was
sort
gonna
of
say, but think
you
about
know,
it. My whole life revolves around my family.
Exactly.
Without my darling bride, she is the rock, the cornerstone.
Yeah, yeah.
If you took her out of it, I'd be lost. I can't admit that to her, but
Yeah.
you know,
This is on TV, but she won't listen.
she
you know.
never watches, so I'm
Yeah,
okay.
you're okay.
You start thinking about everything, you know, and to me, you know you found your life partner when somebody says, when something happens, good or bad, who do you call first?
Yeah,
You know, now all of a sudden, if something happened, either good or bad,
yeah.
and she wasn't there, God, she's been my best friend for 100 years of marriage.
Yeah, yeah,
You know, of course it would have an impact.
yeah. But it's interesting, in this kind of study, we were really trying to map out sort of, well, you know, what is the bias? Because, you know, as a physician, we're interested in, well, obviously this is a terrible thing. You know, there are suicides after divorces. There are people who never get back on their feet again. There are, you know, if it happens at the wrong age, it's, you know, you're very vulnerable. You've got a career crisis and a divorce. You know, you can have some pretty bad psychiatric outcomes. And as a psychiatrist, you know, I'm interested in that, you know, what the impact of this is. But it's also an effect that can be mediated, you know, with increased sensory stimulation. So I guess I started this with, you know, what is the biology of this? If we could figure out something about the biology of this, and I think we kind of understand a lot more than we realized we do when we put kind of a couple of circuits together between sensory input, the brain, and sensory out and motor output. So if I could tell you a little bit about what current thinking is about that, maybe we can think about how we wouldn't just help physically sensory deprived individuals, but also people who go through a sensory deprivation experience after divorce. You know, where I get into it a lot is where I see kids where there's a sort of a suboptimal amount of stimulation.
See, and in your book, I'm amazed, because if somebody ever told me that taking a child, putting him in a perfect, sterile environment, no microbes, no, just white walls, everything's beautiful, they're getting all the attention in the world, versus the same child to a prison mother.
Yes.
I got to tell you, if I had to bet,
Really? So
I'm
it doesn't
not
make sense to
betting
you.
on the prison being a better environment for the child.
Yeah.
But yet,
Yeah, this was a great study in the 1940s. It was he was one of the earliest people to look at this. There were a couple of people in the 40s who were kind of looking at attachment. John Bowlby, Mary Ainsworth, and Renee Spitz. Renee Spitz was the guy who coined this term, anaclitic depression and hospitalism. So what he found was that the patients kids who were who were orphaned for whatever reason, were placed in a hospital or were not given the privilege of going to the hospital and had to stay at home. And what they did was they allowed the children to visit their mothers at the jail. And this was maybe twice a week they'd visit their mothers. They weren't always there. They had a nanny or something. There were no nannies. They were, you know, they might be.
they had a social worker, somebody that took care of their physical needs.
Very, very limited. But they got the mother contact twice a week. And those kids ended up having an increase in their IQ scores over the course of the year that their moms were in jail, even though they started out with a lower IQ. The kids that were better off got placed in this beautiful hospital, and over the course of the year, not seeing their moms at all, they actually had a drop in their IQ, a drop in their motor development too, not just cognitive development, but their ability to proprioception, their sense of their body in space, went down. So, and not only that, but when there was an infection, or there was a flu outbreak, there was more deaths, dramatically more deaths, like 9 times, 10
I was going to
times
say
more
it's
deaths.
almost sort of a magnitude, if I remember right.
Yes.
More fatalities.
Fatality is, and they called it marasmus, dying of, a broken.
Broken heart or.
Yeah. This is the first time this term was coined.
It amazed me when I saw the Spitz study. I said, wow, this must be state-of-the-art current.
1940.
I was say,
Yeah.
70 years ago?
And we knew this stuff, and what the heck are we doing today with these kids who are not getting enough stimulation, not the right kind of stimulation? Again, enriched environment, like is not a crowded cage. It doesn't mean sticking the kid in a foster home with 10 other kids because you're going to have a lot of, it's not pure stimulation,
Well,
it's
from what I
what's
read,
optimal.
enriched environment really felt like optimized environment.
It is. It's enriching it to the point, it's enriching a deprived environment.
Right.
Almost in all cases, you take it, in all the experiments for the most part with enriched environments, you're taking a deprived, bad outcome and enriching it.
You're driving it to the center, to the meat.
And people who are sort of the leaders in this area of research, they would say, this has been a little bit misconstrued by over-enriching some children. So the point where every kid who's coming up in a middle class or upper middle class family has to have, all these songs playing at every, they're not going to be any smarter because they got this extra and this piano lesson or that. It's really that if you're under stimulated.
There's a limit between ignoring a child and being a helicopter parent, hovering.
Yeah, exactly. You almost could, and again, back to the crowding phenomenon in the cages.
Send you like the rats over the threshold.
It's too much. And in fact, they've done these studies where they give one in a bird, I believe it is, they can block the sound in one ear versus the other, and you'll see changes, not just in the back of the brain. If you measure how much how robust the signal is, if one ear is deprived, but also if one ear is overly noisy, so they get this. They don't get a nice bilateral configuration of the brain. The interesting thing is, again, within a given focal period of time, if you give that bird, if you give the rat, if you give the cat, they've done these things with cats where you sew one eye closed. Yeah.
Sewing the one eye of the cat?
Yeah. That guy won the Nobel Prize, by the way, in medicine. But it's fascinating. I mean, this is a great study because they showed that if they sewed both eyes closed, it wasn't nearly as great an effect. But if you close one eye closed, and then you open that eye, close the other eye, blind as a bat. Now you should have monocular vision in that eye.
Right, you lose your depth perception.
You lose your depth perception, but this eye is gone. Now, what would you think you would do to sensory stimulate that individual to bring, if I'm still in my critical period of ocular development, of visual development. So now keep thinking about psychological development and how it might apply, but
is that where they give oxy or
oxytocin?
Yeah.
No, oxytocin wasn't done in this study. All they did. So you tell me what you would do for I don't expect you to know, but what would be the intuitive? What is the intuitive?
Intuitive is you stimulate with wide spectrum input.
Right, wide spectrum input. So you you open the eye, right,
and blast it.
So it's sort of like that, but actually, and this is still done today. So this study was done in, say, the 60s or 70s when Hubel and Rice did these studies in the cats. This actually became a treatment for amblyopia, which is central cortical visual deprivation. So kids who have strabismus, where the eye is out of alignment and one eye is, they're not getting binocular vision. So what do? If you have an eye that's looking the wrong way, you want to stimulate it correctly. So you could shoot that, as you said, you could increase stimulation, or you could decrease stimulation to the good eye. And that's the technique that's typically used. So almost every child nowadays goes to an ophthalmologist who has strabismus or has some kind of what they call amblyopia, which is the visual problem is in the brain. It's not, yes, the eye is out of whack, but it's
really the
it's
processing
not
of the signal.
registering the signals, right, exactly. And so then it goes more out of, it's sort of a feedback loop. But there are other cases where for some odd reason, something just happened to the brain, and that individual isn't getting any stimulation to the back of the brain, just like the cats, where the eye was closed. It wasn't like they were born with an abnormal eye. The eye functions perfectly. But say after a overdose, I've seen a couple of kids where after an overdose, it's quite common in anoxic, after say a heroin overdose, I saw one kid, cortically blind forever, appears to be cortically blind. But that's binocular cortical blindness, so they can't see at all. Very hard to get that back.
Is there any way of getting that back?
There are some techniques, but just to go back to the monocular, because this is the one we see more commonly, sort of kids are born with just like a piece of their orbital cortex missing or not working right, so one eye. So what you do is you patch the good eye, and you just let you let normal stimulation come. You don't overstimulate the good eye, the bad eye. You just don't let the good eye. You're depriving the good eye.
Don't let the good eye compensate.
Right, and this is currently the treatment for amblyopia. You patch the good eye. You see kids, they have strabismus, they have some kind of amblyopia. They're going to go to the ophthalmologist, and more often than not, they'll get a patch, or they get special glasses that have kind of a block on that eye. And so you're gonna just encourage this. So again, I talked about the binocular hearing, the binocular vision, and back to this deprivation state. If a child is not getting the proper amount of emotional stimulation at a certain age, and it's not available because of the environment they're in, you're not necessarily going to you want to overstimulate, but you're going to want to optimally stimulate that area that's being deprived.
But now, if you identify that, and the child's in an environment where the child is not getting the stimulus they need, as a medical professional, what can you do? You can't take the mom aside or the dad and say, "Hey, you wake up.
Right. Right.
You got to fix this. Show some more love to your child." Or
Yeah.
what do you do as a professional in that field?
Well, it's a very tough situation, but so it is a question of where we get into this whole like, well, what is DCF going to do? And a kid who's deprived in a bad environment, do they take them out of the home? Then
Isn't that worse?
Is it worse? What's the optimal? Could we encourage a safe amount of stimulation in the home? Do we put them in a hospital? Is that a psychiatric hospital? Is that going to be more like the Spitz stuff, where you get these kids who are perfectly nice environment?
Till I read that Spitz, I'd say, yeah,
get them out of the home.
Get them out of the home. That's
Right.
all negative. But
Yeah.
then I read the Spitz. I'm saying twice a week seeing your mother.
Yeah, and twice a week you end up getting a better IQ than the kids who were put in the hospital. So it is hard to imagine, these environments finding any kind of substitute for a parental figure. I mean, mom's a mom. There's no replacement. But if you don't do something within that critical period, it's a bit like the eye who's deprived. Right. If we didn't undo if Hubble and Weiss didn't undo the sutured eye within that critical period when they can learn to see, the cats never developed vision in that eye, and they remain blind in that eye. So if you don't get in there early, so I think most of the intervention has to be within the window when attachments are being formed in early development. So when is that? Probably 2 or 3 years old. So if this kid comes to you at 4 years old and he's been in a deprived environment and abused and neglected.
Ceausescu's Romanian orphanages.
Exactly. I mean, they were.
Talk about putting rats in. I mean, I hate to say that. That sounds terrible, but it felt like rats in a cage. They just showed these large.
Right. It was a terrible situation. Ceausescu was the dictator, and he was overthrown. in Romania, after the Cold War ended, there were lots and lots of murders, and the society sort of became anarchy, and there were lots of kids without parents. So they put all these kids in orphanages, and they found that as soon as they were placed with a foster care parent, the closer they were to placement in terms of time from the point at which they were found in the street or wherever they were found, and placed in the hospital setting, the faster their IQ caught back up to the normal rate, or the closer it came
But they
back.
could get, I mean,
They could.
they could. Not all, but
Right, exactly.
a majority of the kids could catch up eventually.
Right, and then you saw different areas of the brain that were associated with kind of enriched environments reactivating in response. So yeah, I mean, it is possible to say this bond is not going to work. It's a terrible, terrible thing to think about, but if you've tried and tried. But how long do you try? You know, these are very tough when you're dealing with, you know, our world and taking a kid away from their mother, and this is what we're dealing
But
with.
that's always going to be,
We have this.
how bad of an environment is it
Yeah,
that triggers removing the child from
yeah,
the mother or father, regardless of whether they're ideal parents or not?
right.
If you, I mean, I saw the
The
pictures.
optimal thing is to be with your mother. I mean, that's the biological mother. There is no replacement for. But if you do the replacement at 5, 6, 7, as opposed to 2,
Well, it's
3,
like the cat's
4,
eye. If you wait too long, there's no physical reason that
right,
the eye should remain blind.
right. So these are very hard decisions because it's
And
a little
even-
easier when you see, well, we need to open the eye. Now we need to stop
But if you
this
patched the eye
deprive.
and removed it, you get normal function.
Right,
It's, okay, during that learning cycle, I have no reason to
Right.
ever learn how to use it.
that's right. So let's say there is in the brain an attachment system. And the attachment system is a bit like the visual system. It needs to be activated. So we activated in these animals with nestlets, with oxytocin, an artificial environment for soothing and get comfort. And the wound's healed better. So if you think of the wound as an emotional wound, it's not going to heal as well. It was clear in our studies it didn't heal as well as when they had the pups to play with, which is their normal environment. But they healed a heck of a lot better than if they were deprived of
again-
everything. So we're sort of patching. We're sort of patching their deprivation, right? We're patching their deprivation and forcing, as you say, overstimulation or at least use of their attachment system, because now they're stuck in this cage, but at least there's something there that they've got to do with it, and we've taken away some element of
I
deprivation.
remember reading
And in
some
the
of the
case of
Central American studies where children from a DE, deprived environment, from a disease point of view, had much higher rate of diseases and a much longer recovery period. So, when you think of these children that are sent to our border,
Yeah,
I mean, I've always heard, well, turn them around, they're not ours. And I sat there and I actually
the
looked at somebody and
so-called
said, really?
dream children, was it?
Yeah.
Yeah.
If you're on the border and some little kid comes up to you and says, "Mister, help me,"
Yeah.
I want to see
person
you
who turns
turn
them
your back
down.
or kick them.
Yeah.
When it's a statistic, when it's on
Yeah.
paper,
Yeah.
it's easy.
Right.
I can-
exactly.
I can rationally evaluate statistics.
Yeah.
When I see a little child in front of me,
Well,
who-
you know what's going to happen is your oxytocin. Every time I shake your hand, your oxytocin
Tocin
level goes up
goes
a little
up.
bit. But you see a kid who's struggling to get over the border and doesn't have a parent, and they say to you, "Mister,
Help
can you help
me."
me out."
see, I have no mother, no father.
I think you're going to have a bigger
How can
surge
you-
of oxytocin.
I'm going to
and-
OD on oxy.
Yeah.
There's no way I can turn around and say, "Oh, I don't care."
Yeah. Yeah.
I mean, I don't know of any.
Yeah.
Especially medical profession.
Yeah.
I always joked with.
Well, that's one of the issues with the medical profession is sometimes we get over involved because we see such
let's see,
such
your
sadness.
passion is to take care. I mean, I always joked with Jeff Hopkins.
Yeah,
You know, when they say, well, if people don't have medical insurance, they can't get medical care.
Yeah.
And I looked at Jeff and said, how many patients have you ever turned away because they didn't have a Visa
Zero.
or a MasterCard? And he's
Right,
like,
right.
no, once they get to me,
It's gonna
I don't care if they're billionaires or
Right.
just barely making it.
Yeah,
I mean, that's
Yeah.
what MDs have devoted their whole lives to.
yeah.
You know, that little Hippocratic oath thing.
Yeah, that
You
thing.
know, that little thing that, you know, kind of,
And the 16 years of training to get there, to take the Hippocratic Oath, but it's not really, I think anyone wouldn't have to be a doctor necessarily, but you get, as a physician, you get, you get maybe more experience with those most tragic children who are in those kind of
And I
dire
mean-
straits, and you do feel like you got to go
but
overboard.
John, you talk about a little, well, on the rat it was 40%, big cut.
We did on the rats that we went up and up to see, at what point would it just not heal?
when
It
I-
never didn't heal when we had a rat.
When I read your chapter 3 and they talk about amputees, there was some pretty amazing.
Yeah.
Talk to me about, I guess it's
Yeah,
phantom limb or.
So we were going to talk about a little about the biology of this, but so basically, if you have an amputation, I had a kid I was treating who, a very sad situation. He was playing with his friends this game called train hopping. It's I don't know if you've ever heard of it. I think some kids probably listening, if they are kids listening, would know this. It's
Train hopping.
you wait for the train to pass and you try to jump on. And
Okay, don't do it. That's simple.
Yeah, it wasn't a good idea. The kid
Oh
did
my
it. The
God.
kid did it over the summer and did well with his friends. And his friends pushed him to do it in the fall. Unfortunately, he didn't catch it, and he fell under the train. He lost one of his legs, and so I treated this kid, and he described that he was having two things. One was he was having constant sensations of his leg as if it was still there. And this is known as a phantom limb pain. So what basically happens is you have a cortex. The brain, when you touch your hand, I mean, you feel it here.
Here, not here.
Right, in your sensory all the touch nerves go up through the arm, into the spinal cord, up the spinal cord, into the cortex. And so it reads something, and then it probably, whether I hit you hard or whether I'm soothing, you have a motor.
interpret it
Your motor cortex has a response to the sensory cortex and sends another signal down, and your hand moves closer
I'm
or
on
farther
hot.
away.
Don't do that. Get that hand away.
Exactly, the hot-cold reflex, which that's even a reflex art, not going up to the brain, but sort of as you're, touch, whatever the experience of it is. But this leg has been there for a long time. You have this whole leg mapped into your brain in the sensory and the motor
It's all
cortex.
cached, like a computer cache. I've already
Yeah,
stored
I've
what it.
stored the hard drives filled with this leg, and it's still there. And I look down, I don't see anything. It's missing, but I feel my toe.
I feel my toe.
I feel my toe. Usually those symptoms are, within a week or so after the phantom limb sensation, it becomes phantom limb pain. Because what happens is in the cortex, it's also sensing, yeah, I got a leg, but it's not getting the input, the sensory input. So it's a little bit like this amblyopia, the shut eye, the ear. It's not getting input.
I'm not getting what I expected.
Right. So now you've got sensory deprivation, and all of a sudden you start to feel where you normally felt a normal toe, and for the first week kids feel a normal toe, but all of a sudden they start to feel this tingling and numbness, and then it becomes very excruciating pain, and they're in agony. At the same time, they're also having this psychological experience where they're having flashbacks, because every time they feel their leg, they look down, they see a missing leg, they have an immediate flashback to the train.
Reaction to the falling under the train.
And they go into a panic attack. So, which is not dissimilar from the PTSD that we talked about in a previous time, where, the veterans they're having a brain event from the shrapnel, but they're also recalling the shrapnel and having a panic attack from the shrapnel coming at them.
They're under attack, they're under fire.
And they're always feeling, psychologically that way. So again, if this sensory deprivation from here causes physical pain up here, would a sensory deprivation or overstimulation, as in PTSD, cause a abnormal, emotional system response in the same way? You have aberrant sensory stimulation
Now,
coming in. So this pathway, it's basically three nerves, right? You've got one sensory nerve that comes up to the spinal cord. You've got another nerve that goes up to the brain, and you've got another nerve that goes up to the cortex from the brain stem. So three nerves. That's a pretty long nerve, right? All the way down, and there's only one nerve that goes all the way from here to the spinal cord, and a second nerve all the way down to there. So, in a sense, what you're depriving that soldier of, or that kid of, is the same kind of stimulation in an emotional way. When they're experiencing those two things
goes
together.
through the thalamus first?
Yes, it goes to the thalamus first.
So if I'm feeling stress, if I remember, it was pretty dramatic, the scans of the activity in the thalamus
Yes.
on both.
Right.
So affecting the thalamus,
So yeah, this is where it kind of gets into where maybe we can do some intervention. So if you are getting a touch sensation, it goes through the sensory nerve for touch. It's interesting, there's some disorders that are like Guillain-Barré syndrome. I don't know if you know of the syndrome. It's a sudden loss of sensation of a limb. It's usually caused by an antibody that misreads and starts attacking the
it's
mind.
like an autoimmune.
It's an autoimmune disease.
Right.
It's transient. People usually recover from it. So they lose sensation in a leg, and as a result, sensations don't get up to the thalamus, and there's a loss of input to the cortex. But soon enough the leg recovers, et cetera, and they usually recover pretty fully. But each part of the thalamus gets a different sensory input. So if you looked at the thalamus, you'd see touch, you'd see vibration, you'd see temperature, you'd see hearing, auditory sensation, you'd see taste, you'd see smell, you'd see also some kind of limbic emotional sensation. How do you define it? That's what psychiatry is trying to define. It's like warmth, but it's not just, and in a sense, it's so closely related because, when you think of the warm emotional feelings you have, they're usually associated with good touch,
Right.
good holding. The kid who gets smacked around or abused or something is associating a actual physically, and so there
Think
is.
about any grandparent. You talk about a high stimulus level. Let your grandson run in, hold his arms out, and give you a hug.
Yeah. Just,
I mean,
it's-
I would light up the
Right.
scan.
Yeah,
It would
yeah.
be blue-white light.
Yeah, so that's right, and these animals that we did studies where we looked at the PET scans of animals we looked at the glucose metabolism in the thalamus of animals that were brought up without a peer and were, no wounds in these animals, just simply alone or with a peer. There was like, it was
The
like
metabolism rate is
it's
dramatically
like,
different.
It was like flat. It was like there was nothing happening. Everything gets sent up from the thalamus into the brain. So anything that you're gonna feel is you're not gonna have sensation as a result of that. So you have to question, what happens to, say, a person who doesn't have a normal amount of physical stimulation because of an emotional deprivation. Maybe what's happening is they're also just the sort of amalgam of touch, eye contact, experience with talking to another person in a pleasant way. All of those experiences sort of form. And my hypothesis is that there is no one place where this occurs in the brain. But if you have the proper so-called whatever the human body needs to form a connection with another person, you have another person, you play, you interact. These are all sensory experiences, and when they come together in the right form, that is, as a whole, what we call emotion.
Right.
We don't really have one place where emotion is in the brain, the way
and again,
sensations
you
are.
start looking at, I see my grandson, visual stimulation.
Right.
I hear him. I
Yes.
feel him.
Right.
It's not like one set of cells in the thalamus are going to
Right.
light up.
Yes, yeah.
You know, you're going to have varying
Right.
stimuli.
And if you look at those centers that do light up when a person is feeling particularly, like you give them oxytocin, where it lights up? The temporal lobes tend to light up. In the temporal lobes, you have the amygdala, you have that's the fear center. You also have the hypothalamus. Sorry, the hypothalamus is a little below there, but you've got the hippocampus is the other major area that's associated with emotion. You also have the lower prefrontal cortex. These are all emotional areas. Where do they get their inputs from? They get all of their input from the sensory system.
Right.
So psychiatry has sort of been stuck at the front of the brain, looking at temporal lobe and frontal lobes, thinking about, how do we think about ourselves? How do we understand ourselves? Metacognition. But if you really look at what's sending signals into the frontal lobes and into the temporal lobes, which is this so-called what's lighting up when you feel emotion, it's all your sensory systems. So probably at some level, what we experience as emotion is this limbic experience is a proper amount, an optimal amount of emotional stimulation that exists in a normal environment that you have to enrich in a deprived environment. And so that's what we're doing. If someday we get to the point in psychiatry where we could look at sensory input or look at the thalamus in a PET scan and know what's normal, we'd have to, there's obviously a lot of variability. Introverted people have less optimal amount of stimulation than
But
extroverted
when you go back
people.
to the Spitz study, that was physical.
Yeah,
You weren't looking at the biological factors that you're looking at today.
true, but those infants, they became depressed. They became emotionally, they look sad. This marasmus was dying of sadness, really. And these kids died. They died of illness, but they also died in a depressed state. So they weren't getting stimulation and they were depressed. So
It's
maybe,
like the rat pups that moved to
right,
either side. And
they didn't want to relate, Well, actually, those rats that were isolated were hyper-related to strangers. But what they did was they were waiting for their friends
Oh, okay.
to hang out with, and they didn't
So
want
if you put
to.
'em-
If you put back the pet, if you put them back in the cage, in the same strange
Out
cage,
of the neutral, right.
in the neutral cage, but with the rat
Friends,
they knew,
they go back to playing.
which is a normal kid response. But if I see kids in a waiting room and I'm doing, as a child psychiatrist, I'm kind of greeting a kid who's grown up in in an environment that's deprived, they run over and like, give me a big hug. It's not good. It feels
They're
good.
hyper.
Yeah,
It feels good to you, but it's not for
they
the
don't have
child.
stranger anxiety. And this is how they get in trouble. Then the kids go. This is what happens. Then they're very susceptible to abuse. It just is like a cycle
Yeah,
that
they
starts
just
getting
are
developed.
so desperate to
Right.
compensate.
I'll take anything. I'll take it.
Yeah, the
And I
whole
talked
idea
to-
of stranger danger doesn't.
stranger danger doesn't exist. And I remember this woman, this girl who was one of my patients. I talked to her mother, who she was removed from, put back with. But I said to her mom, she said she has a girlfriend now, not a boyfriend. Is she, gay or is she straight? Do you know? She says, it doesn't matter to her. Anything. She just wants comfort.
Right.
She'll take anybody. And it's not,
It's not a physical gender thing. It's
it
an
was-
emotional
it was just
deprivation.
Any warmth that she could get. And she said, yeah, she likes boys more than girls, but it doesn't matter to her if someone's nice.
Right.
And so it's kind of a random need that, you grow up in that way, and then do you learn what you do naturally to your grandchildren, because we're assuming you've grown up in a fairly stimulus neutral, appropriate environment. You just intuitively grasp them at the right amount of the contact. There are kids who are harder. I don't know among your children, but I certainly see different kinds of bonds I form with my kids. But I see with patients, there's some that are more challenging temperaments. It's harder for the parent to bond, but most parents can bond even with a challenging
Oh, yeah.
Kid who's got, is a little more difficult. But, there's a bit of that as well, but there's a certain amount of natural eye contact. You don't over cling
Right.
to you don't hold them too tight, but some of these parents might not know that. If they grew up in
If they came from an environment that they weren't
Right.
accustomed to it.
Right, they might not know, like they might think, let's give him everything, or let's give him, maybe he needs anger, because anger was what sort of my parents did, so I'll just yell a lot.
But I see it when my sainted mother had her knees done. So for the rehab, she went into a facility.
Yeah.
And as you're walking, it felt horrible to see lines of people being warehoused, waiting for that ultimate trip north. And when you talk to the nurses, some of these people got to see their children Christmas, Easter, 2-3 times a year.
Yeah, yeah.
And I sit there and I say, these are the parents that never were with their children. So they've taught their children
Not to be with them.
not to be with them.
Yeah.
And
Yeah.
by the time you realize, it's too late.
Yeah. I think
It's like your 14-week-old rat. Okay, that's gone.
Yeah.
All the critical learning are in the
it's-
children from to 3 years
yeah,
old.
it just keeps getting reinforced. And I think we actually talked about this once before, but some of the studies that have been done have shown that if you do this deprived thing with the rats, the second generation of the rats who are brought up don't lick and groom their pups.
They're
at the
already
same
starting
rate.
to mimic the behavior. I mean,
Right.
what was it? The
And it
most-
isn't, but what was interesting about those studies, they were able to figure out why is that biologically? They were able to figure out that in licking and grooming and cuddling and holding and all these sensory inputs, there's the histones that wrap the DNA that need to be demethylated. That whole wrapping of DNA just has to occur for normal development to occur. And when you are actively stimulating a gene like sound, those genes are unraveling and becoming available.
And we're only starting to understand the effects of methylation.
Epigenetics.
When you look at MGH, Brad Bernstein's work
Right,
at
exactly.
epigenetics, that wonderful paper he just published.
Exactly.
As always fascinating to have you here to learn the biology, how it ties to the psychiatry, how it ties to real life examples.
Yeah.
Thank you.
It's a little less fuzzy than it used to be.
And to our 6 loyal viewers, thank you for joining us. May tomorrow be a healthier day than today. May God bless. Good night. Thank you for joining us.
Not too long since I've been home.